just versus just on the side, just so I can see things a little bit better. Let me go here. Okay. So his blood work is pretty telling, in terms of, I do think it's more likely, unfortunately, that there is two things. Yes, the thyroid, but I think that there's also maybe the more potential for there to be a tumor in his kidney as well. Because I don't think that the thyroid disease would cause him to be this sick, and I don't think it would cause the kidney to get that big.
Okay.
So just to show you the x-ray piece. So, it's okay, man. I know it's a little loud. So this is him on his side. So his head's up here, tail's back here. This is his spine. His diaphragm is here. So this is his trachea, or is his windpipe coming down. This laying over top of his windpipe is his shoulder. It's not anything in his airway.
Is it okay if I snap a...
Oh yeah, of course. Can that help you?
Yeah, perfect. Thank you.
So in his lungs, what I'm seeing is that in this area here, it's where the aorta comes out of the heart and kind of goes back that way. There's also a lot of lymph nodes that live in there. It just looks busier in there to me than it should be. But other than that, I don't see a lot of fluid in his lungs or anything like that. But in his belly, what I'm seeing, like this is his stomach, which is very big and it's full of gas. His liver kind of is okay. It's in this area here. That's his spleen. And then all of these sort of black tubes are all intestines that are full of gas as well. Bladder's pretty big, which we talked about. But then his kidney is like this big, which is probably at least twice normal. So it's pretty big. And then because I wanted to understand what was going on here a little bit better, we did get the x-ray of him on his back. We can do it in two parts. I don't know if you want to get pictures of this one too. So we'll do the chest and then I can move it so you can get to his belly. If you want a picture there. And so on his lungs here, again, he's sort of thick and full in this area. This is the mediastinum, so esophagus lives there, lymph nodes live there, aorta lives there, vena cava lives there. But it's just wider, I feel, than it should be. And then on his belly, again.
Would that be like an inflammation?
It could be like a lymphoma, or it could be that his esophagus is just so full of gas because he's just inhaling air so much, or he's swallowing air. But this is his stomach again, so it's very, very big. Much more big than it should be. Other than that, it doesn't tell me a whole lot. But I was kind of check this just in case he had eaten something stupid that was giving him like an obstruction, or, I don't see any evidence of that. And then on his blood work, so he is in kidney failure. BUN came back greater than 49.98, so the machine higher than what the machine can read, and the high end of normal is 11.42. Creatinine is 575 and the high end of normal is 159. The fact that this is still so high despite him being so emaciated, because a lot of times like these skinny cats will fake us out, that will think, well, maybe their kidneys aren't so bad because creatinine's part of our muscles too. So the fact that he has enough creatinine in his body to be that high lets me know, like this would almost be like blocked cat level, but he peed on the way in, right? So he's not a blocked cat. Phosphorus is quite high, greater than 4.84. High end of normal is 1.94. Calcium looks a little low. I think it's because of the phosphorus in his blood protein. I think the calcium is okay. Blood sugar's back up again, but I think that's stress more so than diabetes. Liver values are mildly elevated, which could be from the thyroid. Total bilirubin is up a little bit, and that could be partly from just not eating well. Magnesium, I don't worry a whole ton about. Potassium's back down low again at 3.
No food.
And then thyroid came back at 137 with the high end of normal being 60. And then on his CBC, which is red cells, white cells, and platelets. He's quite anemic at 26.8, so that's lower than he was back in the spring.
You and me both, buddy.
Yeah, lymphocytes are a little low, which could just be stress. Eosinophils are also a little bit low. So if it was like a parasite burden or something, the eosinophils should be high.
Okay.
So I think we have two very disparate things going on, and both are going to make the other a little harder to treat. So I think that his kidney is really struggling.
Yeah.
My best guess, because it's so big, unless there was like an obstructed ureter or he couldn't get urine passing through or something, but he's making so much urine,
Yeah.
it doesn't make sense to me. And so if there's tumor there, that's impacting his kidneys and how they're working and putting him into kidney failure. If we treat his thyroid and help to bring his metabolism down, it may make the kidneys get worse still. Because a lot of cats will have normal looking kidneys when they are diagnosed with thyroid problem. And then we notice that as we bring the thyroid and the metabolic levels of the body down to normal, that we unearth some lurking kidney disease.
Right.
So I think if we wanted to try and give him a chance, I would try to give him some fluids under his skin to try and hydrate him.
Okay.
We could try him on some steroids and then also maybe treat the thyroid. But I think his big picture is very grim. Like, I as much as I tried to kind of help get a rally for a good outcome back on the spring, I think that there's a very good chance that he would not make it with what's going on. And I'm really sorry. I don't know that you would have been able to detect some of these things, like with the kidney prior to now, you know?
If he was eating and drinking normally.
Yeah. And so with the phosphorus suddenly being so high, that, you know, when I was 20 some years ago when I first graduated, my old boss, you know, just had said that anytime like the phosphorus is greater than like 13, like our prognosis is really, really bad. And so that's at American values. But I think he's going to be well above that in Canadian values.
Yeah.
We can look and see here. I'm going to steal this real quick so I can see.
So, any treatment at this point, do you think would be
I think it's
worse than?
I think that he feels really crappy, and I think he's struggling with his breathing, probably because his acid-base balance is so off in his body. So while I would be always wanting to give it a try, I think his overall prognosis is not good. I think the odds of him having any chance of recovery and getting a honeymoon with him is very low, unfortunately.
Okay.
So the last thing though, I don't want you to be, so it converts to about 15. And so I just remember Dr. Strickland saying that like back in 2003, and it's always panned out, like even with intensive hospitalization, IV fluids, that kind of a thing, that we aren't likely to be able to get them back.
You gave us several months more than we expected.
Yep.
And he was, and I'm grateful that he was so happy, you know? But I think if we were to try and treat him at home, because he would also need a degree of hospitalization that we just can't do here. You would have to go to a specialty center. I think that odds are he would probably die at the hospital, which I think for the cats is often way scarier than what we ought to do sometimes, you know?
Better to happen at home.
Yeah, so would you think that you would want to try and have somebody come to euthanize him at home? Or say good, okay. So I know that there is an in-home euthanasia person. I don't know how they book. Like, I don't know if they're able to come today. But I do think probably decision.
Yeah, I think I don't want him to suffer anymore. It seems like he is. So, if we can't get somebody today, like.
Do you want to try and call and just see if they can't come today? I don't ever want to push anybody, but I would probably do it. Like
Here and then.
Yeah. We have a quieter spot we can move you guys to, so you have more privacy. Otherwise, the next door appointment should be finishing, so that hopefully it won't be so bustling and loud. But I would say if you guys wanted to try and call the in-home euthanasia person and just see if they're able to meet you at home this afternoon, I can give them some pain medicine at least, just to keep them comfortable, and then they could help you.
think he's gonna want us to leave it for him.
You live in Duncan, right?
No, Yubo. Yeah.
Making up a life for you. So I know Sitka is somebody that we have recommended, but they are not apparently open today. Because I had another client say that they're closed on Tuesdays.
Okay.
I thought there was somebody who was in home euthanasia only.
There was somebody around that stopped practicing.
Okay.
Maybe.
And I would do it, but unfortunately the way the licensing is I'm not allowed to without special license to do. So these people have the certification that I want for you. So KLC.
All services currently. Just kidding. I mean, we could try calling them, but Sitka was the original one we were thinking of.
Sitka is what we're
But
trying
if
to
they're
do.
not open today,
This
then
is resting pause. I'm sorry, I don't know where anything
No,
is
of course.
yet. Calgo. That's not even online. So I don't know if you want to try and just give them a call and just see. But otherwise, I think if you guys are leaning towards euthanasia, I would recommend we'll get you tucked into the suite in the back. It's quiet. You can spend as much time as you want with him, and then we can help him. Especially if this car ride is so stressful.
yeah.
I don't want him to get into distress back there. Driving home.
Which he would be.
Yeah. So do you want to try and call Sitka and just see if anybody answers?
Yeah, please.
I'll get you the phone number and then I'm going to give you some privacy.